A very good morning, everyone. This is Namrata, your health coach here at Bagdara Farms. I am live with all of you, and the topic I have chosen for today's live session is something that is scaring a lot of people these days and is heard about a lot in the news and all across. Today, we are going to be talking about monkeypox, right? We're going to be talking about what monkeypox is, uh, since when has it been there, from what family of virus does it come, and how is it affecting the health of people, and how it is affecting us most importantly mentally and stressing us out. So knowing what it is and then taking the right care for it and taking the right treatment of it is going to help all of us in the longer run. So let's start by talking about what really is monkeypox. So have you all heard about smallpox? Smallpox was also, a virus which was there, which was infecting a lot of people, which has got eradicated thanks to the vaccines which came into play, right? So monkeypox is also, it is a rare kind of disease caused due to a virus known as the monkeypox virus, and it is a member of the family which is called as the orthopox virus. Now, orthopox virus is a group of family of viruses, so monkeypox comes from that. Now, what does it lead to? It leads to rash, it leads to flu-like symptoms, right? So, monkeypox was first discovered in 1958, right? This was a pox-like disease which was seen and occurred mostly in monkeys who were put during research work, right? So, it usually spreads from human contact, from animals to humans, from animals to animals also, and now it can also spread from women, from one person to another person through skin to skin contact, through fluids which are there, to the bodily fluids which we say. So monkeypox also comes from, like I said, a family of viruses known as orthopox virus. Now what happens? There are two types of these, right? There are two types of these viruses which are known. The types are known as clades. So one is the monkeypox virus which was originated in Central Africa, and the other one is which originated in West Africa. So these days, all across the world, even in India, we are hearing cases of monkeypox, right? And this monkeypox variant, which is there, is the less severe one, which is the West clads, right? So, like I said, there is Central Africa had these cases, and the West African, places have had these spread of this virus, which is known as the monkeypox virus, right? People are confusing it with chickenpox, but there are going to be some differences, which I'm going to keep telling you in the session while we keep going on. So, monkeypox, yes, is rare, but the variant which we are seeing these days is not as severe as the other one, right? I said the one which is here is West Africa one. The Central Africa one has been the most severe one, which has affected a lot of people in Africa, and has affected the health of many and taken the life of many as well. But the one which we are seeing, the outbreak of the monkeypox virus that we are seeing these days, is of the less severe one. So most importantly, when we get to know about some virus, we get to know about something, rather than stressing about it, it is very important that we read about it, we know about it, to understand that what is it, and since when it has been in existence since when. So, like I said, it started in Africa, but over the years, because of travel, this virus has spread to other countries also. And how is that? Sorry. So for many decades, monkeypox was only confined to Africa, right? However, what happened when people started traveling? So what happened in 2003 was actually the first case, of outbreak of monkeypox which occurred out of Africa, which was in the United States. Now, what had happened in this? There was a shipment which was of some infected animals which was being transported from Ghana to Texas in US, right? So what happened? This infected rodent spread the virus to some pet dogs and infected for people in the Midwest. Now this is how it started, and then international travel has become so common these days that people are traveling across different countries, continents, and as a result of which we are hearing about a lot of new viruses which are being spread, right? Which were earlier confined to one certain locations or certain countries, is now across the world. And again, in the summer of 2021, a case of monkeypox was seen in the US resident. How? This US resident had traveled to Nigeria. And now from Nigeria, when he came back, this thing happened there. So the 2022 outbreak, which we are all seeing, has now spread to other regions. Like, it's from Africa, it has gone to Europe, it's gone to America, it's gone to Australia. Even the Asian countries are seeing it now. So usually, do you know who does monkeypox affect? Monkeypox usually affects children below the age of 15 years, and monkeypox is more common in men as compared to in women. See, it is a virus, so it can spread to anybody, be it a man or a woman, it can spread to anybody. But monkeypox is firstly more common in children below the age of 15 years, and also more common in men who have sexual relationships with another man. So a person having man having sexual relationships with another man is more prone to getting the monkeypox virus. So that is why it is more common in men, for men who are having these kind of sexual relationships. And what are the signs and symptoms? Now, it usually takes 2 to 4 weeks for the monkeypox virus to spread in your body and for you to come out of it, right? So what is it? It's a flu. So you're going to have flu-like symptoms. You're going to get fever. You're going to get chills. You're going to get muscle aches. You're going to get headaches. What differentiates chicken pox with monkeypox is, because a lot of people these days are getting confused with it. The difference is, if you have monkeypox virus, then you're going to have also swollen lymph nodes, which is not the case in case of a chicken pox if you have. So what differentiates this is this, that if you have swollen lymph nodes along with these rash, these red bumps, these blisters filled with pus on your body, then that means it can be the monkeypox virus. Now, what happens? You start with fever, chills, and all of these things, and then your body starts developing a rash, right? These rash is usually flat. It can have red bumps. It can have blisters which are full of pus, right? And there can be a crust over it. That means a thin, scaly skin over it, which can also fall off. And as a result, then you are more prone to infecting another person, because the bodily fluids, that is the pus, can pass from one person to another. Okay. Also, this leads to sores in your mouth, in the vaginal area, and the anus area. So it usually, the whole process of you getting sick with the monkeypox virus lasts for around 2 to 4 weeks. And yes, if you do not take care of it, do not take necessary steps to prevent it, it can go further also. But usually the process time is 2 to 4 weeks. Now, and it's not necessary that everybody who develops monkeypox is going to get all of these symptoms. Many cases usually do not have the same kind of pattern of symptoms, and that is why people get confused. Now, what happens, like I said, that how do you catch the monkeypox virus? Does it spread? Is what we're going to talk about. So, monkeypox is spread usually when you come in contact with either an animal or a person who's infected with the virus, right? That is the monkeypox virus. Now, animal to person transmission, how can it happen? If you have a broken skin, like if the dog scratches you, bites you, the infected body's animal's body, blood, the fluid, and the pox lesions, that means the sores which are there, those sores give out some pus and some liquid. If that gets touched to you and your skin and you get into direct contact with that, that can lead to an animal to human spread. Now, monkeypox can also spread from one person to another. Person to person can be through what? If somebody comes in contact with your sores, with your scab, with your respiratory droplets, any kind of bodily infected fluids which transmits from one person to another can go. And this can also happen with intimate situations, if somebody is cuddling, kissing, or during sexual relationships. So this can spread during sexual relationships, also during kissing as well. So, like I said, it is not too very clear or whether it is spread through the semen or the vaginal fluids also. But yes, it is spread through kissing, cuddling. It is spread through coming in close contact, either through the bodily the infected fluids if touch you in any way or you inhale them. This can lead to the monkeypox virus. And how is it diagnosed? How does the doctor know if it's monkeypox or if it's chicken pox or what it is? The main difference, like I told you, is the first of all, they're going to check on your rash. They're going to check on your symptoms, whether it's measles, chicken pox or not. But if you have swollen lymph nodes are usually a sign that it is monkeypox, and this can be then diagnosed as monkeypox and further treatment can be given. Now, what happens, because it's a virus, right? So there is no particular antiviral drug for monkeypox virus. But yes, because it's a virus, so sometimes antiviral medication, sometimes antibodies need to be developed, so a system for that is made. You're given medications to control the fever and so on. So antibiotics and everything, which in a long way is not good, because antibiotics can cause severe side effects on your system if not properly administered and monitored. Now, if you come to think why we all get so stressed, we read, we see the news, we hear the news, and then we go, oh, monkeypox is spreading. But this is what we need to know, that it is also a virus which is there and has been there, right? It is just that now with frequent traveling, with more awareness, with more information, we are getting to know what it is. So most importantly, stop stressing about the situation, right? Take necessary preventions, take necessary precautions so that you don't get infected with this. But even if you do, you need to know what to do so that you are on the right path to taking the correct treatment and the right path to recovery. Now, like I said, there is no antiviral treatment for monkeypox, but certain medications and all can be given to relieve those symptoms with you. Now, how do you prevent monkeypox? First, you need to avoid contact with any kind of infected persons. You need to avoid contact with any kind of bedding, utensils, anything related with somebody who has been in a contaminated zone or has been contaminated with the virus. You need to wash your hands frequently, which we all have now got used to and are so we are so uh, always on track of washing our hands and all, since we used to always do that, but it is more important now, and more we are following this procedure now also because of, since the 2019 covid outbreak happened, we all have been into this thing, right? But this has always been there. If we are coming from out somewhere, we need to wash our hands, we need to keep our mouth covered, we need to be away from people who are infected with any kind of virus or flu. you know you need to practice safe sex. You need to have use of condoms need to be done. If you are into same sexual relationships also, if you're into the opposite sex also, you need to follow proper safe practices for sex. You need to wear a mask which should cover your mouth and your nose. You need to clean and disinfect that any surfaces which is contaminated with the virus. So you need to do all of that. Now you need to understand that it is a virus. There are many viruses in the air, and it is you who yourself can take care of this and prevent this outbreak from happening to you or your loved ones, right? Like I said, prevention is always better than cure. Why not prevent it rather than stressing about it and then getting infected and not knowing what to do? So like I said, monkeypox, the variant which we have going on right now all across, the 2022 variant of monkeypox, which is there, is actually the West African clade. That means the West African type. And this, is till date, no one has, died about it. The outbreak is there. The outbreak is there because of the travel which is there, right? But if monkeypox is not treated, right? If monkeypox is not taken care of, if you become too casual about it, if you do not know what to exactly do if you get infected with it, then serious complications can often also happen. And these severe complications can be like encephalitis. What is encephalitis? Is basically inflammation that can take place in your brain. It can lead to pneumonia and cause infections in your eyes, which can be fatal. So like I said, if you do not take care of something and let it be, it is surely going to lead to severe consequences and going to cause problems in your body. But if you know what is right and you know what to do, then you can surely take care of it and see how naturally you can get out this, the whole stress about the monkeypox virus. So monkeypox, yes, it is very common these days, and we need to take necessary steps of precaution by maintaining clean hygiene, by avoiding, we need to avoid certain kind of meats. We need to make sure if you're taking meats, that the meats are well cooked, they're brought from a proper place, it's hygienic. All of these things need to be taken care of. Now, like I said, it is a better known virus. Like smallpox was, smallpox has been eradicated thanks to the vaccines, right? So that is why these have similar like symptoms, but it is not as severe as the smallpox which was there earlier. Now, why are we here today? We want to do these live sessions with you because we know how important health is, and we know how important it is to be mentally strong in order to fight any kind of infection. You can fight the biggest of ailments, you can fight the biggest of hurdles in your life, provided your mind is set at the right place and you do not take stress. That is why I'm here to tell you that stop stressing about all these things that are happening around you. Instead, work on your immunity. Instead, work on proper hygiene, good dietary lifestyle. Follow a regime where you have exercise. When you have time for exercise, be it 30 to 60 minutes. You can take out that much time in a whole day to make sure you are healthy. And right here, we at Bagdara Farms promote and give organic supplements made out of turmeric. Turmeric has a component known as curcumin, which has abundant medicinal, therapeutic, pharmacological properties, which does not just help with treatment but also helps with prevention. And the most important part of our product, which I'm going to be talking about today, is Term Flu. So, Term Flu is the product which we recommend for viral flus, for viruses, for any kind of infections or seasonal allergies which happen. Termflu is made out of 100% organic curcumin. It is enriched with curcumin between the percentage of 11 to 19%. So, how does Termflu help you with preventing monkeypox? Most importantly, it will help you by making your immunity strong. It has a strong immunomodulatory property. That means it will boost your immunity, keep your body strong enough to fight any kind of infections just in case you get infected. At the same time, it will also reduce your chances of getting infected with any kind of virus around you. It will keep your immunity strong. It will keep your immunity boosted. It is an anti-inflammatory and antioxidant. That means any kind of oxidative damage, that means maybe the virus, maybe the environment, maybe the food you eat, maybe the stress you're taking, whatever oxidative damage is caused, that can be reduced with the antioxidant property. This oxidative stress damage can cause inflammation in the system. That means swelling. When there will be swelling in your system, your flow of oxygen, your flow of blood supply, the hormones that are there in our body are not going to be circulating in a proper manner, thus reducing your ability for your body to function properly, right? It is an antiviral, it is an antibacterial, it is antifungal. You name a property and curcumin has that. And just normal turmeric would not do the trick for you. It is a turmeric with a high curcumin percentage alone that can help you with prevention and treatment of many health problems, and also will help you by giving you the right treatment that is needed in the correct dosage form, right? So antiviral, this is a virus, right? It is from the orthopox virus category, right? So the antiviral property will help in eradicating or will help in killing the virus that is causing these problems in your body, and will also prevent the virus from coming back into your system. It will help your body make right antibodies so that your body functions properly. So you name a property, it is there. It is an antiseptic, it's an antibiotic, it's a natural analgesic. The rash, the pus-filled blisters can get painful for your body too. The pain, the malice, the fatigue that comes along with a flu can also tie your body down. Your appetite can be lost, right? So this helps in boosting your metabolism. It helps in keeping your appetite fine. It has many properties. Like I said, it can lead to inflammation of the brain. It can, it has neuroprotective properties. So that part of inflammation in the brain can be reduced because one, it's an anti-inflammatory. Two, it has neuroprotective properties, right? So any kind of infection that is there in the human body, be it caused due to a virus, bacteria, fungus, Termflu is the best supplement which you can take for yourself and your family for prevention today. If you are scared of getting these viruses around you, and you are getting stressed to send your children to school, you are stressed yourself to go to work, right? Stress is not going to help. And if you take Termflu, the antidepressant property in our product is naturally going to boost the serotonin and dopamine levels in your body. Imagine a natural boost to your serotonin and dopamine, that is the happy hormones in your system. What difference can it make to your health, right? So all of these properties come because of the high curcumin percentage we have here at Bagdara Farms products. So if you want to know more about our products and specifically more about Termflu, do visit our website. The link to the website is on the screens. It's www.bagdarafarms.com. You need more information about monkeypox, you want to talk to us about monkeypox, or if you're just stressed and want to talk to us and want to know how we can help you, you can also give us a call on our number. That is 9560254646. The number is flashing on your screens. You can just pick up your phones, give us a call on this number, or just drop a WhatsApp also on the same number. That is 9560254646. You will get all information here on the website regarding our products. You will have scientific evidence to show you how curcumin works. We have certifications on the website. We'll also give you a deep insight that we are certified by USA, FDA, and FSSAI. We have a lab report that shows that the curcumin percentage in our products is between 11 to 19%. For any more details, you can also check out our reviews and see how customers are happy and satisfied with the response of our products. So that's all I have for the session on monkeypox virus. Please stay safe, keep healthy, eat a good diet, exercise regularly, and most importantly, stop taking stress. Stress is going to lower your immunity, and stress is going to let the foreign invaders, like any kind of virus, invade your body. So let's stop taking stress and let's enjoy living a healthy life, a holistic life with good eating, a lot of family time, right? And a lot of exercises too. That's all I have for the session today. I'll see you all again soon. Thank you.